Could we be seeing an increase in the number of COVID-19 infections due to the loosened restrictions? Experts agree that complacency could lead to a second restricted festive season for South Africa. That's if we don't act with caution over the coming weeks. For perspective on this then, and the possibility more broadly of a fourth wave, we're joined by Palindrome Data Digital Epidemiologist Rufaro Samanga. Rufaro, a very good afternoon to you. Welcome. I'm glad I could make it through that title. I'm having some speech issues today. Let's start with the basics. A lot of concern has been raised, especially through this weekend, about our R rate, which is now back above 1. What does that mean, and why do we have to look at it constantly?
Cool. So the R rate, or, the reproduction number in epidemiology, really refers to, or is a description of how infectious a particular disease-causing agent is. So if we're sitting with an R rate or a reproduction number of 1, that basically means that for every individual that is infected with COVID-19, that they then have the potential of infecting one other person with the virus.
So currently it's at just above 1, so not quite crisis mode yet. Is it too soon to start talking about changes in behavior and perhaps even lockdown adjustments?
From a purely public health perspective, it's never too soon to start speaking of potential preventive measures. Currently we're sitting with a reproduction number of 1, but, once we have those behavioral changes, people stop social distancing or wearing masks, people start getting a little more riskier in their behavioral practices, we will start to see that number potentially changing. And then it's very difficult to kind of get it down. So, purely from a public health perspective, I definitely don't think that, now or right now we should be kind of averse to talking about restrictions. I think if ever we're going to have that conversations, rather we have it now, as opposed to finding ourselves in the middle of December where we're at the height of the festive season and now we're trying to kind of, catch up on all of these preventive measures.
And you speak to us at a time where, the date is the 15th day of November. We went to the elections on the 1st. There was a lot of concern that the campaigning and actual voting day would contribute to some kind of surge. Are we beyond the point now where we could say the elections are a source of new infections?
I think, even though, a number of our, cases have largely been dominated by Delta, there's still, consensus that even with the Delta variant, the incubation period is still sitting at around 10 days. So if we're not kind of picking up on those major surges following elections, following those rallies, then we can tentatively say that, we're not going to see that peak. As far as I'm aware, a number of the centers that we have that are, reporting on this data, and the moving averages that we're using, which I think is about 7 days, allow us to keep the data fairly up to date. So if we haven't experienced that peak as of yet, then, I don't think it's something that we should be right now, at least concerned is going to kind of catch us off guard. But of course, there still is the potential to experience a peak going into the festive season.
On that peak then, we've vaccinated a number of people. South Africa is unlikely to meet the target of vaccinating 70% of eligible people by the end of 2021. But do you think what's been covered so far will help us to blunt the surge enough to avoid a repeat of the catastrophic scenes that we saw during the 3rd wave?
It's a combination of things. So when we talk about, containing diseases, especially on a pandemic level, it's really good that we have seen an uptick in our vaccination numbers, if we compare right at the beginning of this vaccine rollout. So we have done considerably better. But of course, it isn't just about having this one silver bullet. So in as much as we're managing to get even more South Africans vaccinated, I think currently 1 in 3 adult South Africans is vaccinated. Although we're still far from that target, we are making headway, but also it's very important and to emphasize to South Africans that, even if you have been vaccinated, doesn't mean that you can start, acting a little more risky in terms of your behaviors. We still need to make sure that we are sanitizing hands, we're washing hands, you're keeping your social distance, and you're also wearing your masks properly, because, what we can potentially see is even though we have an increase in our vaccination rate, we might still struggle to get those COVID numbers numbers down purely because people are now changing some of their behaviors. So it has to happen in tandem. It can't just be, well, I'm vaccinated, so I won't do the rest. It has to be a collaborative effort where you're observing very many of these preventive measures in addition to, being vaccinated on top of that.
And government is quite desperate to get those vaccination numbers up before the festive season. Just this weekend, there was the big launch of the Vuma vaccination drive, which allowed government to vaccinate more people than it usually would during the course of a weekend. But where is the disconnect, do you think, between the calls for people to get vaccinated to avoid serious illness and death and this reluctance that we're still seeing among some South Africans?
So a lot of the work that I'm currently doing is actually, investigating and exploring vaccine hesitancy, specifically with regards to the COVID-19 vaccine. So about 2 weeks back, I was actually working with the Department of Cooperative Governance and Traditional Affairs in Gauteng with a number of their municipalities doing a series of webinars specifically addressing, vaccine hesitancy. And one thing that has consistently been coming up is, just the sheer effect of, misinformation. A lot of people are saying, hey, I am not averse to getting vaccinated, but I've read something here or someone has said something or the other. And of course, that creates that hesitancy and, which leads to a reluctance in terms of showing up and getting your jab. So just from that aspect, I've been looking a lot on social media and also in some of my consulting work at how do we better address vaccine hesitancy? How do we allow platforms to exist where people are actually allowed to ask their questions in real time? And they're able to get responses as well.
Do you think that the very strong push against what we're told was anti-vaxxer sentiment, denialism, that strong push, not just from government, from the South African government, but globally, actually may have had the reverse effect, hardening the positions of people who were already skeptical and doubtful of the vaccines and even the pandemic itself?
It's always important for me to distinguish that, when we talk about anti-vaxxers and we talk about vaccine hesitancy, those are usually referred to as very different groups. So anti-vaxxers are, a group of individuals for whom there is no sensible or logical argument that anyone can make to convince them to become vaccinated. However, people who have some level of vaccine hesitancy are, it takes a couple of things to kind of address for them to be swayed and convinced that, getting vaccinated is the right thing for them to do. So to be quite honest, I think at the beginning of this pandemic, just looking at South Africa, we weren't struggling with anti-vaxxer sentiments. We're struggling with vaccine hesitancy, which is something that we're still seeing even now. When we look at the history of vaccines and acceptance rates of vaccines in general in South Africa, we usually don't have issues with administering and having acceptability of vaccines. And that's pretty much been the same trend with COVID-19. However, we have seen, though, that the vaccine hesitancy rates have been a lot higher with COVID-19 vaccines specifically versus some of the vaccines, that are already existing. So I think the case, the scenario is a little different in other countries. If I look at the US, they have an established anti-vaxxer community, right? So they have not only just been battling with vaccine hesitancy, which can often be addressed through, providing the right information and resources, but they already have these established anti-vaxxer groups that, were already, even before the rollout of, these COVID vaccines, were quite against it. But I don't think that that is currently or has been the case in a South African context.
Dr. Rufaro Samanga, good to speak to you. Grateful for your time today. Thank you.
Thank you.